Good afternoon. Thank you, Chair Roth and members. I'm here to present AB 3059, which will improve health outcomes for premature infants. I would like to thank the committee staff for their work on this bill. This bill will require that commercial health plans include coverage for medically necessary pasteurized donor human milk, which is commonly referred to as donor milk. If the donor milk is sourced from a milk bank with an existing tissue bank license, the bill waives the requirement for hospitals to acquire the same license to provide donor milk to infants in neonatal intensive care units or NICUs. The American Academy of Pediatrics recommends that when a mother's own milk is not available, that donor milk be provided to very low birth weight infants. These are very small infants that weigh 3.3 pounds or less at birth. Donor milk is used in NICUs to support the health and survival of very low birth weight infants and has been shown to reduce the incidence of a devastating bowel disease known as necrotizing enterocolitis or NEC. The incidence of NEC is around 60% higher for Hispanic and Black infants when compared to white infants. Black and Hispanic mothers have lower rates of providing milk to their babies in the NICU due to a variety of factors, including having to return to work, sibling care, lack of transportation, less lactation support, or receiving less care in less resourced NICUs. By passing AB 3059, we're hoping to close health disparities beginning at birth. Donor milk is a covered benefit under Medi-Cal, but existing law does not clearly define it as a covered benefit under commercial health plans. AB 3059 would ensure parity and require that all commercial health plans provide coverage for medically necessary donor milk. AB 3059 would also address a challenge to establishing a donor milk program. About 12% of NICUs in California do not use donor milk, and one of the main barriers to establishing a donor milk program is the requirement that hospitals obtain a tissue bank license in order to store and distribute this milk. With me to testify in support of the bill today is Dr. Lisa Stellwagen, Medical Director of the UC Health Milk Bank, and Nicola Jury, a board member of the NEC Society. Thank you.
Thank you, Doctor. Please proceed. Identify yourselves for the record first.
My name is Dr. Lisa Stellwagen, and good afternoon, Chair Roth and members. I am a pediatrician and the medical director of the UC Health Milk Bank. On behalf of the University of California, I'm here as a proud sponsor to express our support for AB 3059. The University of California Health Milk Bank provides safe, pasteurized human milk donated by breastfeeding parents to support NICUs and families statewide. Our milk bank opened in 2020 and addresses shortages in donor milk for sick or small newborns, ensuring life-saving medical nutrition in line with the American Academy of Pediatrics recommendations. Human milk can be life-saving for the smallest premature infants, reducing the risk of necrotizing enterocolitis, also known as NEC, a life-threatening and catastrophic bowel condition, as you will be hearing. NEC is expensive in every sense of the word to all involved, the child, the family, the healthcare workers, the hospital, insurance companies, and society. Through our work, we've identified several barriers that prevent critically ill infants from accessing donor milk, as you've heard from Dr. Weber. And we're very grateful to her for authoring this bill to address barriers in access and to help improve survival of babies in need. I'm happy to answer any technical questions and respectfully ask for your aye vote.
Thank you, Doctor. Next, please.
Chair and members of the committee, my name is Nicola Jury. I'm a doctorate-educated physician assistant and also a mother. And today, as both, I urge you to support AB 3059 to provide medically fragile infants with the life-saving protection they need from human milk. My son, Ronan, pictured here, was born at 28 weeks gestation, weighing just 1 pound, 2 ounces. He was immediately taken to the NICU and began fighting for his life. I focused all my efforts into anything I could do to help him, which at the time was pumping breast milk. After suffering life-threatening pregnancy complications myself, my body unfortunately produced little to none. Feeding and growing is a huge challenge as a micropreemie's underdeveloped GI system is extremely fragile. I was fortunate enough to be at a NICU that had access to donor milk, which Ronan got as soon as he was able. Clinically, I know the importance of human milk. I was thankful for this crucial but limited resource. Eventually, he was transitioned to formula. We faced typical ups and downs of the NICU, and despite progress, after 7 weeks into our journey, Ronan took a turn. He was diagnosed with necrotizing enterocolitis, or NEC, NEC, a devastating intestinal inflammation. He had 2 surgeries with some of the best surgeons in the field to attempt to save his life, but sadly developed a fully necrotic bowel, leading to sepsis. On December 20th, 2020, Ronan took his last breath in my arms. NEC comes on fast and aggressively. I went from dreaming of the day I would bring Ronan home to planning his funeral. The single greatest predictor against NEC is mother's milk, and when not available, donor breast milk is the next best option. Studies have shown that this can decrease the risk of NEC by as much as 50%. After Ronan's death, I connected with the NEC Society, a nonprofit founded by another mother who lost a child from this devastating disease and focused on building a world without it. This is how I parent my son. I have read numerous research articles published about this disease. I have lived through the devastation, and donor breast milk makes a difference. All babies in the NICU need access to breast milk, regardless of location or socioeconomic status, and mother's milk is not always an option, like in my case. AB 3059 will protect families from saying goodbye to their babies. I beg you to make sure that all families in California have access to this vitally important resource and that you join me in taking a step toward building a world without this horrendous disease.
We are so sorry. Thank you for joining us.
Thank you once again to the committee. I would like to thank both of my witnesses who came here to testify. Thank you so much for telling your story. The reality is that when we're talking about very low birth weight infants, it's not uncommon that the mother is unable to actually lactate because we're talking about babies that have been born very, very early. And oftentimes in emergent situations, and so you don't have the hormones that actually bring on labor, which also allow you to lactate. And so most of these babies require donor milk. And so in order to decrease the chances that they develop NEC and have to go through surgeries, whether they are able to survive or not, then we need to ensure that they have access to this very preventable form of treatment. And with that, I respectfully ask for an aye vote on AB 3059. Thank you.
Thank you, Doctor, for your presentation. As soon as we secure a quorum, we'll take a motion and we'll do just that. Thank you for joining us, both of you.